Welcome to the Module 8 of the PSW NACC Certification Exam Prep. In this module, we'll be going through some questions for assisting the family, growth, and development. So we'll be kicking off with question 1. What is a key responsibility of a PSW when assisting families in coping with the loss of a loved one? A. Encourage the family to move on quickly. B. Provide emotional support and listen empathetically. C. Avoid discussing the deceased to prevent distress. D. Offer medical advice to manage grief. Option 1 is inappropriate and insensitive because grief is a personal process and families need time to heal at their own pace, so rushing them can hinder the emotional recovery phase. For option B, a PSW's role is to be compassionate and supportive, offering a listening ear to help families process their emotions, especially during difficult times. In option C, while sensitivity is necessary, completely avoiding the topic can invalidate the family's feelings. So talking about the loved one in a supportive way can often provide comfort. In option D, PSWs are not qualified to provide medical advice. This responsibility lies with the healthcare professionals like the counselors and the doctors. So with respect to the question, our answer is option B. The responsibility of a PSW when assisting families in coping with the loss of a loved one is to provide emotional support and listen empathetically. Question 2. Maureen is relaxing while soaking in a warm bathtub. You know that A. Maureen's heart rate and blood pressure are most likely decreased. B. Maureen's parasympathetic system is in control. C. The nerves of the autonomic system are controlling Maureen's bodily responses. D. All of the above. When soaking in a warm bath, the body often relaxes, leading to a decrease in heart rate and blood pressure as the blood vessels dilate due to the heat. The parasympathetic nervous system is responsible for the rest and digest state, promoting relaxation, bodily recovery, which aligns with Maureen's state in the warm bath. The autonomic nervous system, which includes the sympathetic and parasympathetic system, regulates involuntary body functions like the heart rate, digestion, and blood pressure. And all of these are influenced in the scenario we have here. So our answer is option D, all of the above. When Maureen is relaxing and soaking in a warm bathtub, her parasympathetic system is in control. The nerves of the autonomic system are controlling her bodily responses, and her heart rate and blood pressure are most likely decreased. Question 3. A disorder affecting muscle control and is caused by an injury or abnormality in the motor regions of the brain is called A. Cerebral palsy. B. Down syndrome. C. Cystic fibrosis. D. Pick's disease. Cerebral palsy is a disorder caused by damage or abnormalities in the motor regions of the brain, and this usually occurs during fetal development, birth, or shortly after birth. It affects muscle control, coordination, and posture. Down syndrome is a genetic disorder caused by an extra copy of the chromosome 21. It affects the physical and cognitive development, but it is not directly related to muscle control or motor brain injuries. Cystic fibrosis is also a genetic condition and it affects the respiratory and digestive systems, but it doesn't affect muscle control. Pick's disease is a type of dementia that affects the brain's frontal and temporal lobes, leading to changes in behavior and language. However, it is unrelated to motor function or muscle control. With respect to the options we have, the answer is option A, cerebral palsy. Question 4. At which stage of growth and development do children begin to develop a sense of independence and learn basic skills? A. Infancy. B. Preschool age. C. School age. D. Adolescence. Infancy is when children are highly dependent on caregivers and begin developing trust and sensory abilities. This is usually from birth to 1 year old. So, independence is not a milestone at this stage. During the preschool age, children start to develop social skills and imagination. However, they still rely on adults for most of the tasks, and this is within the ages of 3 to 5. The school age is where children develop independence, learn basic skills like reading and writing, as well as taking on responsibilities like homework and chores. They also start forming peer relationship and understanding societal norms. This is usually between the ages of 6 to 12 years. Adolescence is when children refine their identity, develop abstract thinking, and gain more emotional intelligence. However, basic skill development occurs before the adolescence age. The adolescence age is between the ages of 13 and 18 years. So with respect to the options we have, our answer is option C. The school age is the stage of growth and development where children begin to develop a sense of independence and learn basic skills. Question 5. You and Mrs. Betty are talking about her recent surgery, and you have been her PSW for many years and have developed rapport. Which of the following is a closed-end question? A. How was the hospital stay? B. Do you feel better now? C. What food do you prefer to eat? D. What are your plans after surgery? Open-ended questions are questions that allow someone to elaborate and share their experience in detail. So if we look at all the options we have here, how was the hospital stay is an open-ended question because it will make Mrs. Betty to talk about her experiences in the hospital. In option B, do you feel better now? This is like a closed-ended question because it can only be answered with a simple yes or no without the need to explain further. Option C, what food do you prefer to eat? This is also an open-ended question because it will allow Mrs. Betty to share her preferences in detail. This also goes for option D, what are your plans after surgery? It requires that Mrs. Betty will elaborate on her thoughts and her goals post-surgery. So the question we have is asking, out of the options, which of these is a closed-ended question? Our answer is option B. Do you feel better now is a closed-ended question because it can only be answered with a simple yes or no. Question 6. To help prevent a child from dying from sudden infant death syndrome, you should A. Make sure the baby sleeps in its own bed. B. Cover the baby well to keep it warm. C. Put the baby to sleep on its stomach. D. Put the baby to sleep on its back. While it is advised that babies sleep in the same room as their parents for the first 6 to 12 months, they should have their own firm and flat sleep surface like a crib or a bassinet. This will help to reduce the risk of SIDS, but it is not the most effective single recommendation. Overheating can cause and increase the risk of SIDS, so the baby should not be excessively bundled. Instead, use a light blanket or sleep sack and keep the room at a comfortable temperature. In option C, placing the baby to sleep on its stomach is strongly discouraged because it increases the risk of SIDS by restricting airflow and increasing the chance of rebreathing exhaled air. Option D is the safest sleeping position for babies and it is the most effective way to reduce the risk of SIDS. So our answer here is option D. Sudden infant death syndrome is the unexplained death of an otherwise healthy infant, typically during sleep. So, to reduce the risk of SID, it is recommended that the baby is put to sleep on its back. Question 7. What should you do when you want to bottle feed an infant? A. Allow the bottle to warm to room temperature on the counter. B. Microwave the bottle for 10 minutes. C. Heat the bottle until the formula feels slightly warm on the inner side of your wrist. D. Use the bottle directly from the refrigerator. Our answer here is option C. When bottle feeding an infant, the formula or breast milk should be warmed to a comfortable temperature, and this is typically around body temperature or 98.6 degrees Fahrenheit. Question 8. Which action demonstrates respect for cultural differences when assisting a family? A. Assuming all families cope with stress in the same way. B. Asking the family about their specific customs and practices. C. Suggesting they adapt to Canadian cultural norms. D. Ignoring cultural differences to provide equal care. Option A is not respectful of cultural differences because families come from different backgrounds and they may have different coping mechanisms. So it is not wise to assume that they are all the same because this can be detrimental. In option B, respecting cultural differences is the key to providing effective and compassionate care. So when assisting a family, you have to demonstrate respect for their cultural norms and values and show sensitivity to their unique needs. By doing this, you can ask the family about their customs and allow the caregiver to tailor support in a way that aligns with their beliefs and practices, thereby fostering trust and understanding. In option C, while Canadian culture values inclusivity, suggesting that a family must adapt without understanding their preference is not respectful. Instead, the healthcare provider or PSW should be open to learning and accommodating different cultural practices. In option D, ignoring cultural differences can lead to misunderstanding and dissatisfaction. Providing equal care doesn't mean you have to ignore the cultural differences, but rather you have to recognize them and adjust the care practice accordingly. So our answer is option B. Question 9. Which is not a developmental task of adolescence? A. Developing attitudes, morals, and values needed to function in society. B. Accepting change in appearance. C. Developing leisure time activities. D. Becoming independent from parents and adults. Adolescence is a critical period of development where individuals undergo significant changes, both psychologically and physically. Developmental tasks during this stage can include developing attitudes, morals, and values that is needed to function in society, accepting change in appearance because there are physical changes that will happen during puberty, and this can lead to increased self-awareness and the need to accept and adapt to a new body image. Also, during adolescence, there is greater independence and autonomy, and this is a key developmental milestone because they move towards adulthood. So, while developing leisure time activities can be important for personal growth and socialization, it is not considered a primary developmental task of adolescence. So our answer here, the task that is not a developmental task of adolescence is option C, developing leisure time activities. The focus during the adolescent stage is more on emotional, social, and cognitive development, as well as the formation of a personal identity. Question 10. Which of the following are physical changes of the nervous system that occur with aging? All of the following are physical changes of the nervous system that occur with changing, except A. There is less strength to cough. B. Senses of taste and smell may become dull. C. Sleep patterns may change with age. D. Brain cells shrink and blood flow to the brain is reduced. Looking at the options, the loss of strength to cough is not directly as a result of nervous system aging. It is more related to the respiratory system and the weakening of muscles involved in breathing and coughing. So while this may be associated with aging in general, it is not a direct physical change of the nervous system. In option B, aging often leads to a decrease in sensory perception, including taste and smell, due to the changes in the sensory neurons and the olfactory receptors. Aging can also lead to a change in sleep patterns, such as difficulty staying asleep or experiencing lighter sleep stages due to alterations in the brain's regulation of sleep. Aging also affects the brain, with brain cells shrinking and blood flow often decreasing, which can impact cognitive functions. So out of all the options we have here, the one that is not a physical change of the nervous system that occurs with aging is option A. Question 11. Dad, mom, and your siblings are all part of your A. Single parent family, B. Nuclear family, C. Descendants family, D. Extended family. A single parent family structure is one where one parent is responsible for raising the children due to separation, divorce, or other circumstances. A nuclear family consists of two parents and their children living in the same household. A descendant family is not a term that is commonly used to describe a family structure. It may, however, refer to a family lineage or descendants in a broader genealogical term. Extended family includes the additional family members beyond the immediate household, such as grandparents, aunts, uncles, and cousins, and they may actually live together or maintain close contact. With respect to the question, dad, mom, and your siblings are all part of your nuclear family, option B. Question 12. Severe problems with social interaction, parental bonding, attachment, and general lack of reasoning ability area are associated with A. Autism, B. Epilepsy, C. Spina bifida, D. Cerebral palsy. Problems with social interaction, parental bonding, attachment, and a lack of reasoning ability are all characteristics of autism spectrum disorder. Autism affects how individuals communicate, perceive social cues, and engage in relationships. And some common signs include difficulty with social interaction, challenges with verbal and nonverbal communication, as well as restricted or repetitive behaviors. Epilepsy is a neurological disorder marked by recurrent seizures. It affects the brain's electrical activity. However, it doesn't cause the specific challenges that we have in the scenario. Spina bifida is a birth defect where there is incomplete closing of the spine and membranes around the spinal cord. This can lead to a physical disability. However, it doesn't cause cognitive or social interaction difficulties. Cerebral palsy is a group of disorders that affects movement and muscle tone, and this is due to brain damage that occurs before or during birth. With respect to the scenario we were given in the question, the problems listed are all associated with option A, autism. Question 13. You are assisting a family that is struggling to care for an elderly relative with dementia, and they mention that they are feeling overwhelmed and unsure how to manage the behavior changes. What do you do as a PSW? A. Provide professional therapy for the family to cope. B. Suggest that they move the client to a long-term care facility immediately. C. Offer strategies for managing behaviors and provide respite care if needed. D. Advise the family to ignore difficult behaviors. In these options, suggesting ways to manage common dementia-related behaviors can be helpful. With respect to the question, we'll be going with option C. When assisting a family with caregiving for a relative with dementia, it is very important to offer practical support and strategies for managing challenging behaviors. Dementia can cause changes in behavior that are difficult for caregivers to manage. So, as a PSW, what you can do is suggest ways to manage common dementia related behaviors like confusion and aggression. These might include maintaining a routine, simplifying instruction, or redirecting the person's attention in a calm manner. Also, you can offer information about respite care services that can allow the family to take breaks from caregiving, thereby reducing their stress and helping them cope better in the long term. Question 14. Which of the following should you not do to respect your client's sexuality? A. Allow your clients to have privacy. B. Encourage them to refrain from displaying public affection. C. Respect your client's clothes and grooming routines. D. Allow the client's sexual relationship. In option A, it is essential to respect the client's privacy, and this includes allowing them personal space and time for their sexuality or intimate relationships, as long as it doesn't infringe on other people's rights or well-being. In option B, it is important to honor their dignity and personal rights. So, encouraging them to refrain from displaying public affection crosses the line into imposing unnecessary control over their personal expression. Public displays of affection should only be restricted when they infringe on the rights or well-being of others, but not based on personal discomfort or bias. In option C, respecting your client's clothing and grooming routines demonstrates respect for their individual choices, including their self-expression through appearance and grooming. In option D, as long as the sexual relationship is consensual and doesn't violate any laws or regulation, allowing a client to maintain their sexual relationship is a part of respecting their personal life and rights. So, out of the options we have, what you should not do is option B. You shouldn't encourage them to refrain from displaying public affection because that is infringing on their rights. Question 15. Hormonal changes during menopause results in all of the following except A. Atrophy of reproductive organs. B. Thinning and dryness of the vaginal wall. C. A loss of sexual needs and desires. D. An end to menstruation. In option A, as estrogen levels decline during menopause, the reproductive organs, including the uterus and ovaries, can undergo atrophy or shrinkage. In option B, the decrease in estrogen production during menopause can lead to vaginal atrophy, which causes thinning, dryness, and reduced elasticity of the vaginal walls, and this often results in discomfort or pain during intercourse. In option C, while some women may experience changes in libido or sexual interest due to hormonal fluctuations or psychological factors, not all women lose their sexual desires. Many women maintain or even experience a resurgence of sexual interest, particularly if they manage the physical and emotional symptoms of menopause. For option D, one of the hallmark signs of menopause is the cessation of menstrual periods due to the reduced production of hormones, particularly estrogen. So, out of the hormonal changes listed, the one that does not occur during menopause is option C, a loss of sexual needs and desires. Like I earlier stated, not all women lose their interest during menopause. Question 16. A family asks for your advice on how to help their elderly relative who feels lonely and isolated at home. What is the best recommendation you can make? A. Encourage the family to visit occasionally as the clients will adapt to loneliness. B. Suggest activities that encourage social interaction such as joining a senior group or hobby club. C. Tell the clients to focus on watching TV or reading books. D. Move the clients to a long-term care facility immediately. Out of the options we have, we'll be going with option B. Social isolation and loneliness in older adults can have significant negative effects on their mental and physical health, contributing to conditions like depression, anxiety, and even cognitive decline. So, encouraging social interaction through community groups, hobby clubs, or even regular social visits can help to alleviate these feelings and provide a sense of connection and purpose. Social interactions have been shown to improve mood, cognitive functions, and the overall well being of a person. So, engaging in group activities or hobbies can provide opportunities for new friendships and a sense of belonging, which is very important in old age. Question 17. What is the primary focus of palliative care? A. Curing illness. B. Extending the patient's lifespan. C. Providing comfort and support. D. Improving physical strength. Curing illness and extending the patient's lifespan are not the primary goals of palliative care. Palliative care does not focus on curing or prolonging life, but instead on bringing comfort to the patient. Palliative care is designed to improve the quality of life for patients that are facing serious illnesses by focusing on symptom management and comfort. So the goal is not to cure the illness, but rather to relieve the pain and distress that can accompany terminal or chronic conditions. It also offers psychosocial and spiritual support for both the patients and their families. Palliative care may also involve some aspects of improving comfort through strength-enhancing interventions like physical therapy, but the focus remains on comfort, symptom relief, and holistic support. So our answer here is option C. That is the primary focus of palliative care, to provide comfort and support. Question 18. What are the signs and symptoms of postpartum complications? A. Severe abdominal pain or leg pain. B. Breast engorgement. C. Chills, fatigue, and vomiting. D. Both A and C. Postpartum complications can manifest through various signs and symptoms, and the following are particularly concerning. The first is when there is severe abdominal pain or leg pain. This can indicate infection, blood clotting, or deep vein thrombosis, and this requires immediate attention. Chills, fatigue, and vomiting are also symptoms that are indicative of an infection, such as postpartum infections of the uterus or other complications like sepsis. So, this is a serious issue that will also require immediate attention. Breast engorgement is a common and normal occurrence in the postpartum period, often due to the milk coming in. However, severe engorgement or accompanying pain could indicate a blocked duct or mastitis. So the answer we'll be going with here is both A and C, which is severe abdominal pain or leg pain and chills, fatigue, and vomiting. In postpartum, the key complications to watch out for are postpartum hemorrhage, which presents as excessive bleeding, infection, which includes uterine infections, mastitis, and urinary tract infections, as well as blood clots that can present as swelling, pain in the leg, and redness. Question 19. A client's family is concerned about their elderly relative's reduced mobility and asks you for advice on preventing further decline. What is the most appropriate response? A. Suggest the client stay in bed to avoid injury. B. Recommend physical therapy and assist with mobility exercises as directed. C. Tell the family that reduced mobility is normal and nothing can be done. D. Advise the family to buy a wheelchair for the client immediately. Prolonged bed rest can lead to muscle atrophy, joint stiffness, and an increased risk of blood clots and pressure sores. So keeping active within safe limits is crucial for maintaining mobility. So A is not our answer. Reducing mobility in elderly individuals can be very concerning, but the best way to maintain and improve mobility is through targeted physical therapy and mobility exercises. These exercises are designed to improve strength, flexibility, balance, and overall function, and all of these will help to prevent further decline in mobility. In option C, while some decline in mobility may occur with aging, it is not irreversible or inevitable. So, prevention and intervention strategies like physical therapy can improve mobility and quality of life. In option D, a wheelchair may be appropriate in some cases, but it shouldn't be the first response. A wheelchair can actually limit mobility and increase dependency, so it is better to explore interventions like therapy and exercise first. So the best response would be option B, to recommend physical therapy and assist with mobility exercises as directed. Question 20. Which is an appropriate response when a child and family displays jealousy towards a new sibling? A. Encourage the child to share their feelings and give them individual attention. B. Discipline the child for showing negative emotions. C. Ignore the behavior as it will resolve on its own. D. Reprimand the parents for not preparing the child better. Children may experience jealousy when a new sibling arrives because they feel a shift in attention and affection from their parents. So it is important to acknowledge their feelings rather than dismiss them. Encouraging the child to express their emotions openly and giving them one-on-one time can help them feel valued and secure. So this is the best approach because it supports the child in adjusting to the new family dynamic while reinforcing positive emotional development. Individual attention and validation of feelings are key in reducing jealousy and fostering a healthy sibling relationship. Question 21. Calling an elderly client mama conveys respect and caring. True or false? We'll be going with false here. Referring to an elderly client as mama may not always convey respect and caring, as it can be seen as overly familiar or infantilizing, depending on the individual's preferences and cultural norms. Many elderly clients may prefer to be addressed by their given name or a more formal title, such as Mrs. or Mr., to maintain their dignity and sense of autonomy. So it is important to ask the client how they prefer to be addressed, as this respects their individuality and promotes positive and respectful communication. Question 22. How can a PSW best assist a family dealing with stress caused by caregiving responsibilities? A. Take over all caregiving tasks permanently. B. Encourage family members to seek counseling or join support groups. C. Suggest the client move to a long-term care facility. D. Provide criticism if family members are not meeting expectations. Providing emotional support by suggesting counseling or support groups can help family members cope with the emotional burden of caregiving. Support groups provide a space for sharing experiences, while counseling can offer professional guidance in managing stress and navigating challenges. Additionally, these resources will help the caregivers to connect with others who understand their situation, thereby reducing isolation and offering practical advice. So our answer is option B. Question 23. Mr. Miller had a stroke a few months ago and he can use his right arm. However, you have decided to feed him because he is very slow. What principle are you not providing? A. Autonomy. B. Justice. C. Beneficence. D. Non-maleficence. Autonomy refers to respecting a person's right to make their own decisions and allowing them to perform activities to the best of their abilities. In this case, by feeding him instead of allowing him to attempt feeding himself, You are not fully respecting his ability to make choices and engage in the activity on his own, which would be part of his autonomy. Justice refers to treating all individuals fairly and equally, but it is not relevant to the question we have here. Beneficence principle involves doing good and promoting the well-being of the person. While feeding Mr. Miller can be seen as helping him, doing so without his active participation might not fully promote his well-being in terms of independence. The principle of non-maleficence is that of do no harm. While you are not directly harming Mr. Miller, you are potentially preventing him from developing or maintaining skills that promote his independence. So the principle you're not applying with the scenario we have here is option A, the principle of autonomy. Question 24. You are giving Mr. Smith a bed bath, and while cleaning his perineal area, he gets an erection. What is the correct response? A. Call another PSW to see what is happening. B. Tell his roommate about what is happening. C. Oh my, looks like something is going on down there. D. I need more towels, so please give me a moment and I'll be right back. Bathing and grooming is a very personal and private moment, and when a patient gets an erection during a bed bath, it is important to handle the situation with professionalism and sensitivity. An erection is a natural and involuntary physiological response that may occur for various reasons, even in situations where it is not sexual in nature. So the best approach in this scenario is to remain calm, avoid drawing attention to it, and continue with the task once the patient has had a moment of privacy. In option A, calling another PSW is unnecessary because it will create discomfort and it may violate the patient's dignity. So in this kind of scenario, it is important to maintain confidentiality and professionalism. So the correct response will be option D. You can say you need more towels and then you step out to give the patient or the client the time to gather himself. So that is the best response in this kind of scenario. Question 25. According to Maslow's hierarchy of needs, food and water are A. Self-actualization needs, B. Physiological needs, C. Safety and security needs, D. Self-esteem needs. According to Maslow's hierarchy of needs, physiological needs are the most basic level of human needs and are essential for survival. Physiological needs includes food, water, air, shelter, and other elements that are critical for maintaining life. Safety and security needs are things like physical safety, financial security, health and protection from harm. Love and belonging needs involves relationship, family, and social connections. Self-esteem needs focuses on confidence, respect, and achievements, while self-actualization needs concerns personal growth, fulfilling potential, and creative results or pursuits. Food and water are the basic level of human needs, and they are very essential for survival. So they are among the physiological needs according to Maslow's hierarchy of needs. So our answer here is option B. This brings us to the end of the Module 8 video of the NACC-PSW certification exam. Don't forget to like, comment, and share, and also hit the notification button so that you'll be informed when the Module 9 video will be dropping.